Welcome back, everyone. This is going to be a great conversation. Do you or does someone you know suffer from type 2 diabetes? Are you taking medication, spending thousands on test strips? Wouldn't it be great to just make all of that stop? Yeah. Dr. Olivia Joseph is with the Wellness Connection Center, and she is here to help. How are you, Doctor? Nice to have you here. Happy New Year to you.
Thank you for having me. Happy New Year.
So you say that this kind of diabetes is a systemic problem. When you say that, what do you mean exactly?
So the biggest issue with diabetes is not the blood sugar itself, it's the systems of the body that it attacks. So you hear of people having diabetic complications like blindness, neuropathy, cardiovascular disease, kidney failure, liver failure. So once that glucose is too high for too long, it starts attacking tissue all over the body.
So I think the underlying premise is then instead of just attacking that single symptom, you have to treat the body holistically. And
Absolutely,
look at the big picture,
and that's
right?
the only way you can successfully approach diabetes when you're just focusing on blood sugar. That's where people get frustrated because it's medication after medication, huge healthcare costs, and people just don't feel better.
You mentioned the costs. I want to go back to that because while obviously there are serious health risks, this is a really expensive disease to battle too, isn't it?
Very. So on average, if you have type 2 diabetes, every year your medical costs are about $15,000. So if you're diabetic for 10 years, 20 years, which is the case for many people. Yeah.
That's a retirement nest egg.
Yes,
That's not something we should be. So type 2 diabetes, also called adult onset diabetes, as opposed to something that you're born with or develop very, very young. Is it something that you can eliminate from your life? Because I feel like we hear mixed things when we ask that question.
Right, and a lot of people hear from their doctors. Some doctors say it's reversible, some say it is not. We know for a fact type 2 diabetes is reversible. And another fact is, even though it's adult onset, it's hitting a younger and younger demographic, and it's hitting a thinner and thinner demographic. So there's a lot of judgment around this disease as if people earn it somehow. No, we're seeing it in people that are not significantly overweight and that are at a younger age. So it is reversible, but there's no medication out there, none, that will reverse it. There's no diabetic diet out there that's a one-size-fits-all approach that, hey, if you eat this way, you can reverse your diabetes. You really have to approach multiple systems of the body that are involved with glucose metabolism.
And I assume that that's exactly what you're doing in the office. That's what's going to differentiate you guys.
Absolutely, that's our approach. We look at things like cortisol levels, nutritional deficiencies, toxicity, infections, even infections within the gut that affect glucose metabolism. So most of the research being done on diabetes in the last 5 years is being done on bacteria and gut health. But yet most people never have that looked at.
Right. We're still learning.
Yeah.
Now here's the thing. If you want to see if you qualify for a free diabetes seminar, which could open a lot of doors for you, call the number on your screen right there. It's 636-323-3646, or you can check them out on the web, thewellnessconnection.com. That's thewellnessconnection.com. Doctor, thank you so much.
Thank you for having me.
You bet. Guys?
Good discussion. That was good.